So, so we are the players for PROMETRIC 1000 MCQ, ebook subscriptions, all Oman Viva data flow, short package, mobile application, dedicated mock test. So, this is myself, Dr. Munjal. I'm hemato-oncologist and bone marrow transplant fellow, and good experience, clinical and academic. Dr. Arti is a consultant pediatrician and taking lectures for pediatric. Dr. Madi, also internal medicine cardiologist, excellent speaker. Dr. Shikha recently shifted to Dubai. She is a consultant gynecologist taking lectures for gynec. She is in the group. So anyone have any gynec query, post it in the group, right? So Dr. Shikha will answer. Recently, she answered one questions of this questions, right, regarding hypothyroidism and hyperprolactin. This is Dr. Ankit, is gastrointestinal physician, DM gastroenterologist. This is our team. Dr. Meghna, Dr. Anjali is also there, definitely taking care of the uh, data flows from Dubai. Our contact details. This is our recently updated book for Prometric 1000. We have many offers. Dr. Anjali is mainly heading the data flow from Dubai. So any exam booking or transfer of license or documentation or anything related with the data flow, feel free to call her. This is the number, both two numbers, one Indian as well as UAE. So you can contact on UAE if you are in UAE. Mock tests are also there. We recently updated many mock tests schedule on our website. And recently, very excellent and good news is that we design one exclusive offer for everyone, which probably lasts and ends by 15th of the August. So you may, I mean, get discount up to 450, where you get everything: online subscription, online coaching, plus hard copy book, everything. So let's start our main thing, mock test, right? So this is the first questions in front of your screen. Take your time and get your score. If you have less than 50% of the score today, it's not good idea. You need to little prepare yourself a bit hard before going for the exam. So just keep in mind, I mean, it just general assessment, right? So you get to know, and don't expect every time very easy or lollipop questions in the exam, right? Because you may get sometime tricky as well. So we are little trying to solve the trickies. So first question is method of reducing harm from the unnecessary or excessive new medical intervention. Into bracket example is obtaining unnecessary imaging that will not change a patient's treatment plan. So this is the which kind of prevention it is. It is a primary prevention, secondary, tertiary, quaternary, none of the above. Take your time and give here the chat box. Then we start discussion as usual. We would like to go concept based, not ratify. We do not need to mug up any answer. We need to understand the logic behind the answer and how you differentiate one from another. Why not A? Why not B? Why not C? That is main learning, right? So that is what we try to learn and improve today. Yes, anyone. So they are asking method of reducing the harm to the patients from unnecessary or excessive new medical intervention, like obtaining lots of imaging unnecessarily that will not change the patient's treatment plan. So even without that, you can doing it. So which kind of prevention is that? Primary, secondary, tertiary, or quaternary? So far, I did not get any answer in the chat box. Yes, post your answer so we can start our journey for discussion. So far, only one answer. I'm waiting for two, three more answers. Then we'll go ahead. Not in hurry. Very good morning, Radhika. No one? Otherwise, I will ask the name, specific name, because think in that way that if the same questions comes in your exam, how you gonna reply to these questions? How you react with these questions? Yes, Radhika, we'll start with you. So, what do you think? Yes, Radhika, what do you think? What could be the answer?
I'm not sure, sir, but I don't think it is primary prevention. I'm ruling out primary prevention.
Okay, so let's discuss one by one gradually. What do you mean by primary prevention? Tell me something about primary prevention, one example of primary prevention, definition of primary prevention, or something about primary prevention. What you understood in your mind about primary prevention. You got my questions, or you are still confused with my question, Radhika? You got my questions or not?
Yes, sir.
Okay. Yeah. So, do you have any clear-cut idea in your mind about primary prevention? Yes or no? If you don't know, say no. It's fine. I mean, it's a learning platform. That is why we are
No,
doing
sir.
this exercise. No, fine. So, what your homework, Radhika? So, don't waste your time and utilize your Sunday and try to read what is primary, what is secondary, what is tertiary, and what is quaternary. Right? Just try to read by your own. Right? We will discuss. Yes, Dr. Fatima. What do you understand by primary prevention, Fatima?
Sir, primary prevention is I think mm, the startup पे हम कोई भी जो preventive measures लेते हैं to avoid to get infected or to prevent the
So,
disease.
so give me some example that, okay, sir, this is the example of primary prevention, right? I will give you lots of example after your explanation, but what's
Vaccinations to the
okay,
newborn जो vaccinations हम करवाते हैं that
okay,
is
right,
primary
got it. So
prevention.
vaccination. So primary prevention is what I mean. Can you explain little bit in some words, or you don't have exact word in your mind? Right? So vaccination is the example, but if I can tell you how you explain the primary prevention, so let me explain you. Primary
Okay.
prevention is a prevention which prevention of the measures or prevention is a taking up measures which can prevent the occurrence of disease, which can prevent the occurrence of disease, disease को होने के पहले ही रोकना. That is called prevention before the taking the measures before occurrence of disease. Example, exercise. So if you do regular exercise, you can prevent hypertension, you can prevent obesity, you can prevent diabetes, you can prevent ischemic heart disease, you can prevent stroke because it has a role in all these things. So those who are regularly doing exercise, they have less chances of hypertension, diabetes, obesity, IHD, stroke, and it is a long list. It is a very long list, right? So by doing exercise, you can prevent the hypertension, you can prevent the diabetes, you can prevent the obesity, you can prevent the stroke and heart disease. So this is before development of the heart uh, problem or before the development of any disease or before the development of stroke. You are taking some measures which can prevent the stroke. That is called as a primary prevention. So primary prevention is a taking measures which can prevent the occurrence of the disease. So before disease occur, you can prevent it. Is that clear, Dr. Fatima? Yes or no? Tell me yes or no.
Yes, sir. That's it.
So one example is exercise, right? Second example is a vaccination. So vaccination, how it's important vaccination. So by giving the vaccine, like tuberculosis vaccine, you are giving to the baby at the time of birth, especially in Asian countries. So you are trying to, I mean, giving the BCG vaccine, you are trying to prevent the tuberculosis. By giving the oral polio vaccine, you are trying to prevent the polio. By giving the DPT, diphtheria, pertussis, tetanus, you are trying to prevent this disease. By giving the MMR, measles, mumps, and rubella, you are trying to prevent measles, mumps, rubella. By giving typhoid vaccine, right, you are trying to prevent the typhoid disease. Blah blah. It's long list, right? So just trying to make you understand that this is all the primary prevention. So before tuberculosis happen, you are doing something to prevent the tuberculosis. So you are taking some measures by giving the BCG, right, to prevent the disease occurrence. You don't need disease to occur, right? So this is called primary prevention. Is that clear to everyone? Yes or no? Any question?
Yes, sir.
Right? So this is a primary prevention. So keep in mind. Yes, now tell me, Fatima, what is a secondary prevention then? Now, primary prevention, you did it nicely. right? Now, what is the secondary prevention, right? So this is learning, right? We don't need to mug up only answer quaternary, because they may not ask you quaternary, they may ask you tertiary, they may ask you secondary, right? So you need to know all four primary, I mean, types of prevention. Yes. So what's the secondary prevention? Anyone? What's the secondary prevention? So secondary prevention, let me tell you. So this is the primary prevention, is prevention of disease before occurrence of the disease, right? So this is a primary prevention. Secondary prevention is a early detection.
Yeah.
One word definition is early detection or subclinical detection, subclinical stage. So before the sign and symptoms develop, you are trying to find out the disease, right? Subclinical, right? Subclinical disease you are trying to find out. So this is called as a secondary prevention, right? So subclinical. So what's the example? Biggest example is screening. We are doing lots of screening tests. Say for example, screening mammogram, right, for the breast cancer, doing screening pap smear, doing stool for occult blood for colon cancer, doing colonoscopy, right, for the screening, right? There is no breast cancer, but we are trying to early detect. Why we are doing mammogram? What's the advantage? Are you going to prevent with the mammogram? So mammogram is not going to prevent it, so that is why it is not a primary, right? Mammogram will not stop for the development of the breast cancer, but if it is there, if it is in a very early stage or subclinical stage where you don't get any lump in the breast, where you don't get any pain, where you don't get any nipple discharge, or where you don't have anything, still after 50 years of age you are going for mammogram regularly, that is called secondary prevention. If it is there, you can detect before subclinical or before the sign symptoms develop. So this is an excellent example. So any screening test, doing body checkup for your father and mother. Why we are doing body checkup? B12 level, vitamin D level, lipid profile, 2D echo, CBC, thyroid, sugar, calcium, uric acid. This is what we do in our own country, right? So why we are doing it? We are doing this screening. So if something at subclinical or very early stage is there, where we don't have any sign and symptoms and will detect it in the early stage, that is called secondary prevention. Are you getting me, Fatima? Right? So this is the secondary prevention. Is
Yes,
that
sir.
is that clear to everyone
Sir,
or any
if there
confusion?
is,
Yes, ask the question.
yes, sir, if there is an outbreak of any disease and then we are getting vaccinations, that would be secondary prevention.
What do you think? Are you going to prevent or are you going to cure? So say for example,
Uh,
COVID outbreak is there, right? It's a pandemic disease across the globe. So now what you are
yes.
trying to
As
prevent,
primary.
right? Right. So when you are giving to the people who is not affected with the COVID-19, it is a primary prevention. But when you are
Hmm.
treating, it is not a primary prevention, right? Is that
Yes.
clear? Right. So
Giving a
before,
vaccine to the infected person, secondary prevention.
yes.
Yeah.
So primary prevention is prevention of the disease before it occur, right? So before disease, this is before disease. Before disease,
Right.
you take any measures, right? That is primary to early detect, very early detection or subclinical, it is a secondary prevention. Tertiary prevention is prevention in which you are trying to reduce the mortality plus
Yes.
morbidity. So disease already occurred, right? Say for example, hypertension. Now if hypertension, right, it is now 120 over, say for example 140 over 90. You know that if you don't do it, it will go to 170, 100. It will go to 200 by 120, and patient may have stroke, patient may have MI, patient may have renal failure, right? So this is complication. So prevention of complication, prevention of mortality and morbidity. You take some measure. So what measure you take? You start antihypertensive. Is that clear? You start antihypertensive. Here you did not started anything. It's a screening. It's a screening. Here you did not started any treatment. Here you did not started any treatment. So this is before occurrence. This is early detection, and this is early treatment. You can say in simpler word. Here secondary is a early detection. This is early treatment. What happens if you don't treat the sugar of 200 after 5 years? Are they going to improve or are they going to worsen? Somebody has HbA1c of 8 and he's not taking any care. He's not taking any medicine, he's not doing any measures, what is going to happen down the line? Worsen or improve? Worsen or improve? Tell
Worsen.
me at least. Worsen means
Worse.
he will end up with some complication, right? 2 years, 5 years, diabetic nephropathy, diabetic retinopathy, diabetic cardiac disease, or diabetic neuropathy. So treating a diabetes, treating hypertension, treating coronary disease, which is trying to prevent the complication, right? So this is early before disease, this is early detection, this is early treatment, and this is quaternary is something the same definition. So this is what I tried my level best to make you understand in a simpler language, right? So this is the same story it is given here. So nothing new, right? Primary, it prevents before the disease occurrence, that is vaccination, right? Or exercise, right? Or any other measures which try to prevent the disease. Secondary is early disease detection by screening test, right? And this is a early treatment. This is early detection, early treatment to prevent the complication. This is a tertiary, and quaternary is method of reduce a method of reducing harm from unnecessary or excessive new medical intervention, right? Like this scenario, right? So this is called as a quaternary prevention. So mainly in our clinical practice, what do you think, which one is the best one? Fatima, what do you think, which one is the best prevention across the globe? If you want to do prevention, which one is the best prevention? Which is the best prevention? Primary, secondary, tertiary, or quaternary? Which prevention is the best? Fatima?
Primary. Primary.
Primary, obviously primary, because we don't need anyone to get disease, right? So primary prevention is prevention of the disease, and which is the most difficult part. Nobody, if I can tell you, okay, don't eat junk food, primary prevention, right? But you will keep eating junk food, you will not obey the advice, right? I will tell you, try to do 15 minutes aerobic exercise, you will not do, right? So people are not much interested in primary prevention because probably it is a free, right? So they want to spend a lot of money
Yes,
for
sir.
treatment, but they don't want to spend the money, simple money, to prevent hypertension, diabetes, regular exercise, no smoking, no alcohol, right? Weight reduction, yoga, meditation, mental relaxation exercise, stress reduction. They don't want to do because this is the primary prevention, right? So try to always concentrate on the primary prevention. Give all the advice to your patients for the primary prevention, right? That is our duty as a doctor. So these are the four various types of prevention. There is no fifth prevention. Penta prevention is not there. Primary, secondary, tertiary, and quaternary. So you must know they may sometimes ask you in the statistic and all questions. That is why I included these questions to bring more clarity to your mind. Is that clear to everyone? Is it clear to everyone?
Yes.
Yes or no? Right? So now
Yes.
do
Yes,
practice with
sir.
more. So whenever any comes across you, you try to now judge which kind of prevention is this, right? Whatever we are doing, the treatment in the hospital is most of the thing is a tertiary prevention, because patient in the hospital usually comes with a complaint, right? With hypertension, diabetes, thyroid, liver disease, renal disease, pulmonary disease. So already they have disease, right? So what is the say for example hypertensive crisis, if you don't treat, they may have hemorrhage in the brain. This is tertiary prevention. So you admit the patient and try to control the blood pressure so he will not develop the brain hemorrhage, right? This is tertiary prevention. So we want to switch our practice from tertiary prevention to secondary and primary, right? So always advise the patient. So if your score is 1 out of 1, good score. If you are getting today mock test more than less than 50%, that's not good idea and time to go for exam. Push more yourself bit hard for next 15 days and try to achieve on all our mock test on website at least 75% plus, right? Because paper will not come the way you prepare. They have their own style, so you have to be well prepared. Second questions. A 56 years old male with past medical history of hypertension present to his physician, primary care physician, complaining of difficulty achieving erection, which has caused significant strains on his sexual life and relationship. He diagnosed as a erectile disorder, right? Which is the most appropriate treatment? SSRI, MAO, amphetamine, sildenafil, beta blocker. Take your own time, think of it properly, and then give the answer. Dr. Bahar Toprak, welcome. What's your answer here?
Thank you. I think it's enough fail.
Okay, fine, fair enough. So let's see what the other experts are saying. We'll discuss. I'll get back to you. You just only posted the answer. We are more than 25 people on Sunday morning, but I got only one answer. So I'm waiting for at least 5, 10 answers. Yeah. So, Dr. Utpal, any comment from you? Dr. Utpal, I want if you can able to interact. Dr. Utpal, Dr. Sharin, Dr. Samia, what's the answer? You can unmute your mic. If these questions will come in exam, what you gonna tick? What's the answer? Yes, what's the answer? Doctor, yes, Sharin. Yes, Sharin.
Sildenafil, sir.
Sorry?
Sildenafil, D.
D. D-sildenafil. So why it is a D-sildenafil? What is special in the sildenafil? What is sildenafil?
It will not,
Tell me
it will
something
help
about
in
sildenafil.
infection.
Another indication of sildenafil. What is this diagnosis? So for those who are joining me first time, let me tell you one more thing, which is I'm repeatedly telling in all of my lectures. Everybody is aware of it. I designed one triad from my own, right? So this triad is triad of MCQ basically, right? Where you need to know three things for each scenario: diagnosis, investigation, and treatment. So first of all, you need to tell me, Dr. Sharin, what is the diagnosis of this patient? Because without knowing the clear cut diagnosis, how you gonna jump on the investigation and treatment, isn't it? Yes, tell me
Here,
now.
we know that he is hypertensive,
Okay,
but we do not know whether he is on any medication for hypertension. He might be on beta blockers, which will
okay.
cause, which will affect his uh, uh, sexual life, or which will decrease his erection. In
Hmm.
But taking into consideration that sildenafil will reduce the hypertension, as well as it will not affect the um, it will not cause erectile dysfunction. I feel that it is sildenafil.
Okay, fine, fair enough. Let's see what others say. Zainab, any comment? Dr. Zainab, any comment?
Yes, sir.
So
Sir,
what is
I
the
think also
diagnosis here?
uh, there
Diagnosis
is
is erectile disorder. No? They have
erectile.
given, no need to confuse. No?
Yeah.
Diagnosed as erectile function. A known case of hypertension. So don't get confused. It's every time it's not a hard question. It's a given already. Diagnosed as. So anyway, diagnosis is erectile dysfunction, right? Right. So it's difficult in achieving the erection, right? So erectile dysfunction, right? So how you gonna treat this patient? How you gonna treat this patient? This is the list of the medicine, right?
Sir, I was
What do you
thinking
think?
of sildenafil, and also like I was thinking of SSRIs, but uh,
So which one is better? Sildenafil is better or SSRI is better?
uh,
Which is more effective
Hello,
and safety?
the more
Yes,
effective,
hello.
is
yes, we
the
can
more
hear you, sir.
Yeah, sildenafil we cannot give the because of the hypertension. So it's better to
Why
go
it
with
is
the
not
SSRI
given? So why
because
not
it
it is
will.
given in the
It's not given because it can cause sudden cardiac arrest.
sudden cardiac arrest in hypertensive patient? If you give the sildenafil in hypertensive patient, does it cause sudden cardiac arrest?
Yes.
I'm just trying to understand.
But
Okay,
the
so
drug of
you
choice
just
for erectile dysfunction is sildenafil. But in
okay, so you need to
hypertensive,
decide. It's a past history of hypertension, and probably the hypertension is under control. They had not commented much that it is a complicated hypertension or renal failure or stroke or something. It is history that 56 years elderly man, so he
then we
could have
can go with the
hypertension.
sildenafil. If the hypertensive is in control, then we can go with the sildenafil.
So see, sir, in exam, whenever you get anything, any questions, something is not mentioned. Say, for example, CBC here not mentioned, right? Here the
Yes.
sugar level is not mentioned, fasting or random. That means it is a normal. Vitals here,
Okay.
if it is not mentioned, means it is normal. So something
Okay.
not mentioned means normal, considered in that way. You understand? So now
Yes.
again, you can have the liberty to choose your answer. So if this patient comes to you, what will you select? You have one options only. Either you select SSRI or you select the sildenafil. Now, what will you
I will
choose in
select
your
for the
exam?
go for the sildenafil.
Fair enough. Excellent. Fair enough. So this is clear cut in your mind that okay, fine, you're gonna select this sildenafil. I'm happy anyway.
Yes.
Yeah. So now next, any candidate who wants to select any other medicine or why or yes, Dr. Bahar Toprak. What do you think? What's your comment?
Actually, hypertension. I didn't about hypertension. Um, first first treatment for erectile dysfunction. First sildenafil.
Sildenafil. Okay. So now can you tell me sildenafil is used in which other conditions? This is another question, right? So one indication you told me it is used in erectile dysfunction. This is one indication. So if any patient comes to you with erectile dysfunction, you may prescribe the sildenafil. Is there any other condition where you can prescribe sildenafil as well,
Loss of
apart
libido.
from
In loss of libido, in low dose, we can give for the sildenafil.
So pulmonary artery hypertension.
libido is a brother of this? Okay, fine. So
Sir,
erectile dysfunction,
pulmonary
libido,
artery, pulmonary artery
pulmonary
hypertension.
pulmonary artery hypertension. That is another indication. Any other indication? If anyone can remember that, okay, fine, sildenafil is not just used for erectile dysfunction, but it can be used for pulmonary artery hypertension or any other conditions as well. So you need, right. So this is one question in exam which is high yield. So here the answer is sildenafil, right? So what is the treatment? If I can change this completely answer, and if I can say you, what is the treatment of premature ejaculation? Both are different question. Premature ejaculation is different. Erectile different dysfunction is different. So erectile dysfunction is a problem in the penis where it
Panic
is very
prostate
difficult to erect.
hyperplasia.
Right. So
In premature ejaculation, we can go with the tadalafil.
okay. So again the same option. Again the same option. What will you select? Same questions, right? But options are this one, two same options. But here the erectile dysfunction diagnosis, here premature ejaculation diagnosis. So what is the first line treatment? What is the drug of choice amongst this? Still it is sildenafil or it's different?
We can go with the sildenafil. We can go with the sildenafil along with the low dose of SSRI. Both can be used.
Okay, great. So I want the literature from you by today evening, right? Any one literature which suggests that low dose of SSRI with sildenafil is effective in premature ejaculation. We will discuss this in our platform for the learning purpose, right? It is not, I'm not trying to cross check you. I'm just trying to make your knowledge bit more strengthened and proper, right? So you cannot make any mistake in the exam, right? So
Okay,
sildenafil
sir.
is for erectile dysfunction and premature ejaculation, the drug of choice is SSRI. So far, what I reviewed the literature, I did not get much things about combining the SSRI with sildenafil. But if you have something or you probably used in clinical practice, just do let me know so I can improve my knowledge as well. So far
Yes,
for
sir. In
the
clinical practice, I have used it. In
fine, but
clinical
we need
practice,
to
I
have
have
a
used it.
but this is sir evidence-based medicine, right? So
Yes,
in
yes, it's
clinical
business.
practice, in clinical practice, I have used many chemotherapeutic drug which is not written in the book, but still I got a improvement
Yes,
in the cancer patients, right? I
yes,
used
yes.
lots of endo, endoxan or cyclophosphamide, methotrexate, thalidomide. I use which is called as a off-label indication, which is not
Yes,
written in the book, but I have seen the response in those patients. But I'm talking about right now the literature written evidence-based medicine, right? So if this question will come in exam for eject this premature ejaculation, as of now the answer is SSRI. Meanwhile, we
yes.
do some research and find out SSRI plus sildenafil literature. So what is it? This is erectile dysfunction, sildenafil, PDE5 inhibitors. It is sildenafil. This is one the drug pharmacological. Another is a vacuum assisted erection devices. It is available probably not much in India, but I have seen many in US and Canada and other parts and Kenya as well, where people with erectile dysfunction they are using the vacuum assisted erectile devices. There is a pump, right, which you I mean like a, sphygmomanometer. There is a bulb, right, to elevate the this mercury in the machine. Same bulb is there. So if you inflate this bulb, the penis may erect, right? So this is vacuum assisted, and some occlusive rings are also available. Sorry, I had a bad viral. So this is what the thing is. And premature ejaculation, as I told you, SSRI, right, is a drug of choice. So keep in mind, right? So this is little line between this. Another literature I got it today, sildenafil sold under the brand name of Viagra, right? So this is very famous brand, Western world, Eastern world, Asian world, everywhere. Viagra is used for the erectile dysfunction, and the indication, as you guys are rightly told, erectile dysfunctions, pulmonary artery hypertension, and as I told you, off label, right, it is used in symptoms and Raynaud's disease as well, Raynaud's disease, right? So if pulmonary artery hypertension, it releases the pulmonary artery pressure and it helps in pulmonary hypertension. Same way, it probably dilate the blood vessel and helps in the Raynaud's phenomenon. So you go and read the Raynaud's. So this is the one line, premature ejaculation, SSRI, erectile dysfunction, sildenafil. Is that clear to everyone?
Yes, sir. Thank you.
Wonderful. So this is very interesting questions. 2 out of 2 is a good score. So check your own score meanwhile. Third questions in front of your screen. Which of the following drug is contraindicated in post MI? MI stands for myocardial infarctions patients due to dose dependent QT prolongation. So, which of the following drug is contraindicated means you cannot use in a post MI patient. So, some patient comes to you with a chest pain, you diagnose post MI, right? I mean, MI, myocardial infarction, after 1 week, it's a post MI period, right? And patient has a prolonged QT interval, right? So which drugs you cannot use it, right? Citalopram, sertraline, escitalopram, paroxetine, right? And another questions back to back is which SSRI is contraindicated in pregnancy? So let's discuss these two questions. First, which drug is contraindicated? So take your own time, put your answer A, B, C, D. We'll discuss. Today's all questions are very interesting, not routine questions. In my language, it's not all lollipop. Let's post more answers. Just I'm getting only 2 answers, 3 answers only. I want at least 5, 10 answers because everybody's exam going, na? So you need to post the answer. Yes, Dr. Fatima, sertraline. Why you feel sertraline is a drug, not citalopram, not escitalopram or paroxetine? Fatima, let's discuss. I usually ask to the doctors those who have given the wrong answer, just for discussion purpose. So your answer is wrong. So let's discuss. And those who are
Sir,
having the background, yes, yeah, go ahead.
to
Go ahead, doctor.
prevent QT prolongation, I think antidepressants नहीं देते उसमें.
Which drug? Sertraline. Your answer is sertraline. So first of all, tell me some few names of SSRI. Let's get the basic. We are not going to discuss lots of questions today. I had 11 questions. This is third question. But whatever we discuss, permanent solution. So do you know, Fatima, what is the full form of SSRI, first of all?
Yes,
Dr.
sir. It's
Fatima.
selective serotonin reuptake inhibitors.
Selective serotonin reuptake inhibitor. Excellent. Now give me 2, 3, 4 names of SSRI. I'll write down. Whatever you speak, I'll write down.
Uh, sertraline,
Sertraline. Okay. Second,
citalopram,
citalopram,
fluoxetine, paroxetine.
fluoxetine. Okay. Fair enough. Somebody's making background noise. I'm muting everyone. Just you can unmute your mic, Dr. Fatima. You can unmute your mic.
Yes,
I'm
sir.
getting a lot of disturbance. Okay, fine. So now you are absolutely correct. So these all are the SSRI, right? So SSRI, right? Now this is the
Yes,
name
sir.
of the drug. This is name of the drug. Now tell me any
Right.
three indication. This is name of the SSRI, right? Because you should know, na, being a clinician, that okay, you prescribe
Yes, sir.
fluoxetine 20 milligram OD, but you need to know what is fluoxetine basically. I'm not trying to make you expert in pharmacology, right? But you should know, being a doctor, basic indication and side effect. You must know these two things. Every doctor must know the drug properly, which group of drug, what is the recommended dose, what is the main indication, and what is the contraindication or common side effect. Irrespective of anything, you must know, because you are a clinician. You must know, right? Before prescribing, you can't say, oh, I don't know the side effect. Patient may die of some side effects, right? I know chemotherapy, but I don't know what is the side effect of chemotherapy. Patient may die because of anthracycline, cardiac toxicity, and he'll die. He'll not die because of breast cancer. He'll die because of the drug which I had given to the patient, called as anthracycline or doxorubicin. I did not monitor, and 6 months down the line, he has a 20% ejection fraction. He died. That's not good idea. So you must know. Fine, fair enough. So these are the drug. Now tell me few indication, Dr. Fatima, for SSR. I mean SSRI in general. What are the condition where you use the SSRI? Tell me at least one,
Um,
two, three condition where you use the
to
SSRI.
treat depression,
Depression, okay. Depression, you can use SSRI. This is one. Second,
um,
sorry,
for premature ejaculation.
Hello,
premature ejaculation.
sir.
1 minute,
Can I
sir. I
speak?
am coming to you. 1 minute, sir. I am coming to you. Let her finish.
Okay.
I am coming to you. Give me time. Let her finish. I'll come to you, sir. I'm not in hurry. Depression, premature ejaculation. Okay, what else?
And अब your mind में नहीं आ रहा sir.
No problem. So, what's your homework? Today is your homework. That is why we are discussing. So, here you are past. You had given the good names. Here you need to know the what are the indication of SSRI, where you can use the SSRI, and take a picture
Yes, sir.
or remember or write. You need to know the contraindication of all four drugs. Contraindication, where you cannot use citalopram, where you cannot use the
Okay.
sertraline, where you cannot use the escitalopram, and where you cannot use the paroxetine, right? This is your homework.
Okay,
So
sir.
you do it generously. Take your own time, nothing urgent, because your exam going, I know, right? So I
Yeah,
don't
sir.
want to make you any questions, right? Because it may come, na, what are the absolute
Yes, sir.
contraindication in which you cannot use sertraline? You don't know. So we are not going to mug up the answer. We are going to go properly with the conceptualized question discussion. So this is what the thing is. Yes. So Dr. Sharin, you told paroxetine. So what do you think, Dr. Sharin? Your answer, what I can see in front of my screen is a D. D is a paroxetine. So why it is a paroxetine? Can you tell me a little bit? And this homework is not
Sir,
for just Fatima.
I only
Those who
know.
don't know, 1 second, sorry. Those who don't know all the
Yes, sir.
contraindication of citalopram, Dr. Bahar, you also need to know, right? What is the absolute contraindication of citalopram or escitalopram? Yes, Dr. Sharin, sorry to bother you. Yes.
Yes, okay, sir. I just remember now that it should not be given in pregnancy because it causes some cardiac problem, cardiac defect, or bleeding, increased bleeding. I can only remember
First of,
that right now.
yeah. So, but for this patient post MI, right? Which of, so paroxetine is contraindicated in post MI? Simple question. Because you posted D,
Mm,
and D I thought is a
yes, sir.
paroxetine.
Yes,
So
sir.
are you?
Yes, sir.
Hmm,
Yes.
Fine. So now
Mm,
let's go to the question answer
I thought
discussion.
I correlated it with the pregnancy, and I knew pregnancy it is contraindicated. So
Fair enough. Fair
it's
enough. Fair enough.
okay.
I respect your answer. So real answer is a citalopram. Which of the
Okay.
following drug is contraindicated in post-MI patients due to dose-dependent QT? So answer is citalopram. You cannot use it, right? Citalopram is the answer here. SSRI, as rightly told by Dr. Fatima, selective serotonin reuptake inhibitor. These are few examples. Fluoxetine, sertraline, paroxetine, citalopram, escitalopram, and fluvoxamine. Right? These are the few name of the drug because different people are using different drug depends on the patient's profile. Right? So there is no one SSRI for everyone that everyone use prescribe uh, sertraline, right? There is some you need to see who has hypertension, diabetic, heart disease, kidney disease, obesity, depression, which indication. So there is no, this is a commonly used drug. So this I may prescribe fluoxetine as per the patient's profile. Somebody else will prescribe sertraline, somebody will citalopram. So we need to see the context of the patient, what patient exactly have and where you cannot use. This is the biggest important thing in any antipsychotic drug, right? Even if you can have lesser effect, it's okay, but you should not add the side effect, especially in psychiatry. This is the indication. This is the presynaptic SSRI. So it acts on the presynaptic level and try to inhibit the reuptake of serotonin, used in patient of anxiety, OCD, obsessive compulsive disorder, social anxiety, panic disorder, post-traumatic stress disorder, right? And selective mutism, depression, adjustment disorder, persistent dysthymic syndrome, pseudo dementia, complex grief, premenstrual dysmorphic disorder, right? Bulimia, eating disorder, body dysmorphic disorder, kleptomania, and somatic syndrome, and premature ejaculation. We read. So it's a long list basically, right, Dr. Fatima? But you need to know where you can use all these drugs. It's a very extremely important, right, to us to know being a clinician,
Yes, sir.
right? And citalopram side effects are sexual side effects, GI distress, agitation, insomnia, tremor. But the specific citalopram contraindicated in post-MI patients due to dose-dependent QT prolongation. So in that case, what you choose? In that case, you use the sertraline and escitalopram. So those who has given the sertraline, rather it is a drug of choice in a post-MI scenarios. So keep in mind, right? And paroxetine is a drug which is contraindicated in pregnancy due to the fetal cardiac defect, especially in the first trimester, and pulmonary hypertension in a third trimester. So that's the real literature. Whatever I'm speaking is from authentic evidence-based medicine, nothing from my side. So this is all authentic from the books, and I do lot of research before coming to you or presenting to you. So that's all. The answer for now, citalopram cannot be used or contraindicated in post-MI, and paroxetine, remember PP, paroxetine pregnancy. So pregnancy paroxetine cannot be used. Fourth question in front of your screen. 3 out of 3 is a good score. An 8-year-old male present with the multiple, it's a complex and it is a variety of questions. So it is not one just gynec questions, pediatric, or it's a complex of all the subjects I created, and I create every time the same thing. So your complete overall knowledge can be checked like exam. So this is pediatric questions, right? That was psychiatric questions, right? So that was different question. First is a little different primary and secondary. So all various varieties of question. So your knowledge can be checked properly. So 8-year-old male present with a multiple episode of transient blank stares in a school, right? So 8-year male means boy, 8 years boy, probably studying in third or fourth standard, and he has a transient black stares in the school. Transient black stares in the school, and at home with a 3 hertz spike and wave complex on ECG during episode, diagnosed as absence seizure. Which of the following is the first line medication for this treatment? Is it ethosuximide, right? Is it a valporate? It is a lorazepam. It is a levetiracetam, or it is fosfenitoin. Take your time, give some brainstorming, and give the answer. Nothing urgent. Take your 15-30 seconds.
Hello, sir.
Yes, sir.
Yeah, I will go for the ethosuximide.
Okay, fine. Fair enough. So I'll notate your answer. Let's other people, doctors also give the answer and then we discuss.
Okay.
Yes, Dr. Hina, any comment, Dr. Hina? I would like to hear from you, Dr. Hina.
Sir, ethosuximide and valproic acid is a drug of choice for absence seizure.
And valproate. So which one you select, ethosuximide or valproate? Valproate,
Ethosuximide.
ethosuximide. So what is special in what is ethosuximide? Do you know what is ethosuximide, which group of drug, or what is the commonest side effect, or how the ethosuximide will going to help this patient, and what is the absence seizure basically? How you differentiate absence seizure, right? What is the commonest presentation of absence seizure?
Absence seizure, it occurs in only for few minutes, I think.
Few minutes. How many minutes? Few minutes includes what? 1 minute, 2 minute, 5 minute, 8 minute,
1 to 3
few minutes,
minutes.
1 to 3. So if it is a 3.5 minute, then it is not an absence seizure.
Sir, absence seizure is loss of consciousness without loss of postural tone.
So loss of consciousness without loss of postural tone. Okay. So patient is conscious or unconscious? In absence seizure, patient is conscious or unconscious? Okay. And they have like a breathing from mouth, or they have, I mean, like a generalized tonic-clonic convulsions kind of things is there or not there
No,
in
no,
absence?
no, no tonic convulsions. Just
It is not there. It's
unconscious.
not there. Just unconscious. Okay. And how many minutes? Is there any time duration or time frame for absence seizure?
1 to 2 minutes, because if it would be more than 5 minutes, then it's epilepticus. So 1 to 2 minutes.
1 to 2 minutes. Dr. Ina is saying 3 minutes. Anyone wants to add? Manjit Singh, would you like to comment on the duration of the absence seizure or definition of absence seizure? Anybody wants to comment on the definition of absence seizure? Because we read this word thousands times from since our medical school. But we need to know no, what is exactly the absence seizure, what is status epilepticus, what is grand mal epilepsy, what is petit mal epilepsy, blah blah. We read a lot of things, but we never thought of these things in our practice. That oh, we just I mean fine. Answer is ethosuximide. Forget about the answer. But I want to make some concept in your mind, not just the mug up the things, right? So if you don't know, go and read today completely read only absence seizure, how absence seizures present, what are the presenting signs symptoms of absence seizure, how you gonna diagnose the absence seizure, and how you treat the absence seizure. That's it. So if you don't know, read it. Generously you read it, right? I don't want to waste time now because we are not going to do PhD in absence seizure, but being a clinician and being a exam going aspirant, you must know. So as absence seizures, first line treatment is ethosuximide. Yes, it is correct answer. And second is a valproate, right? And lamotrigine if females of childbearing age. So if somebody is childbearing age, right, they have this absence seizure or childbearing age, you must use the lamotrigine. That is the drug of choice. So what is HYF? Whenever you see HYF in my slide, it is high yield fact. Means it is most important point. So most important point. Absence seizure can occur in otherwise healthy child. He is healthy, leading to loss of consciousness without loss of muscle tone, and there is no post-ictal status, which is there in some patients like generalized tonic-clonic convulsion. They have convulsion 2 minute, 3 minute, and after that they are drowsy. They have some bite. They have some other laziness phase. That is called post-ictal, means post-convulsion state or post-convulsion confusion, which is not there in this patient. They are like they have for 1 minute, it is gone. They are absolutely normal. So it is usually in a childbearing where all of the sudden child is very active, but 1 minute he is absolutely like unconscious. It is absence seizure. Again, go and read in detail, right? So Dr. Fatima told very nice word that loss of consciousness, but without loss of muscle tone. So muscle tone is maintained. That is absence seizure, and treatment of choice is ethosuximide. Jump to the next question. Gynec questions. Switch from pedia to gynec now. 21-year-old female college cross country runner, right? So she's a sprinter runner. Olympic is now going on. So she's a young athlete, 21 years of female college cross country runners, present with 2 years history of amenorrhea. On examination, BMI is 18. On labs, FSH means follicle stimulating hormone, TSH, thyroid stimulating hormone, and prolactin levels are normal. So here they are asking and jumping directly on the treatment. So what is the treatment? So there is one more questions before jumping to the treatment. What is the diagnosis? And then you can jump on the treatment. So whosoever is giving me the answer of treatment, also give me the answer of diagnosis as well. So your time starts now. You think over it. What do you think? What could be the treatment? Yes, Dr. Bahar Toprak, you tell me. What do you think? What is the diagnosis first of all?
Extreme exercise
Sorry?
prevent.
So what should I write down, Dr. Bahar, here as a diagnosis? I want to diagnose this patient. What is the diagnosis, or what is the possible diagnosis, or what is the differential diagnosis, or what is the likely diagnosis? Tell me. They are asking treatment, but do you think without I can tell you, okay, I have one patient of weight loss. What is the treatment? So how do you tell the treatment of weight loss? You need to know this weight loss is because of diabetes, they have weight loss. They because of hyperthyroidism, they have weight loss. Because of some underlying cancer or malignancy, they have weight loss. They have nutritional weight loss. They have psychological disorder, anorexia nervosa. Because of what they have weight loss, even if you don't know what treatment you're gonna give to this patient, same things it applies here, right? Without diagnosis, how you gonna treat this patient who has a amenorrhea? Main question is amenorrhea. They have 2 years amenorrhea. She is a sprinter, she is a runner, she is a young female, right?
It's
So tell me now,
a functional hypothalamic and amnesia.
who has given the answer? Sorry.
Yeah, this is
What's your name?
Dr. Shama from Jaipur.
Yeah, great, wonderful. You are a very brilliant lady. Wonderful. So this is a tricky name. So why Dr. Sama it I mean strikes to your mind that this is a functional hypothalamic amenorrhea? What is the clue? This is a very fancy name, no? Functional hypothalamic. So how we you correlated with the hypothalamus?
Uh, because patient is athletics, and it's caused by the stress and the undernutrition due to this, most probably.
Excellent.
And
Excellent, excellent. This is the things. This is the thing. So diagnosis we did it. She did it excellently well. Functional hypothalamic amenorrhea, usually seen in young females, stress, not eating, runners, right? So there is a functional hypothalamic. So from hypothalamus, the hormone called as a GnRH, gonadotropin releasing hormone, is less, and it causes menstrual either irregularity or absence or amenorrhea. So in this case, they have given the amenorrhea. Sometimes they may give you, Dr. Sama, the history of irregular menstruation. That is also okay. Fine, fair
yeah.
enough. So now you hit the diagnosis, tentative or possible. What do you
Mm,
think? What could be the treatment of this patient? If
mm,
patient you diagnosed very nicely, functional hypothalamic amenorrhea, you did it, right? You checked it, everything is fine. It is matching this, right? So now how you gonna treat this patient? You need to treat this patient. Na? You need to start 21 years of female with amenorrhea. How she gonna become a mother? How she gonna become a pregnant? How she gonna conceive? So you need to do something, isn't it? Yes or no?
yeah.
Right. So what will you do? That is what I'm just wondering to understand.
I think we should firstly maintain the body weight and all, increase the calorie intake, something like that, and increasing the bone health. So,
Fine, fair enough. So again, you have to select from A, B, C, D. What you select?
um,
The question in exam, you need to select only one, right? Maintaining the body weight is not here, so it is important, but we are not discussing that and
mm,
osteoporosis. What you gonna use from A, B, C, D? Anyone, open for all. Anyone. I mean, I'm very extremely happy with her diagnostic answer.
Counseling also.
Sorry,
Counseling.
counseling. So we did a counseling. Now options are A, B, C, D. So what will you select from A, B, C, D? Yes, Dr. Bahar, any idea? Now diagnosis is done. Diagnosis is done. Most of the people say none of the above, but there is a one of the above, not none of the above, one of the
Behavioral
above.
therapy.
Sorry?
Behavioral therapy and counseling.
Yeah, that
Counseling.
is there. That is a primary non-pharmacological treatment. But
Okay.
options, this questions comes in exam because counseling is not in the option. So you cannot add a counseling. Na? So you select from A, B, C, D. So if you want to select in exam, what will you select? Yeah, that is
These
that
two.
lifestyle changes, counseling, cognitive behavior therapy, some blah blah you give. That's all. Okay, fine. That is, but if
Uh,
you want to select from A, B, C, D, what will you select? Fine. So this is a functional hypothalamic amenorrhea as excellently told by Dr. Sharma. So hypothalamic, what is that? That we need to understand first. Hypothalamic amenorrhea or FHA or functional hypothalamic amenorrhea is a condition that occurs when the hypothalamus, a gland in the brain that regulates your body process, stop producing gonadotropin releasing hormone. I told you GnRH, and GnRH is the hormone that starts the menstrual cycle, right? And in this condition in effect, so you either have irregular or absence or no menses, that is called amenorrhea, right? So this is the triad. What is a triad in functional hypothalamic amenorrhea? Is a diagnosis of exclusion, which it is typically associated with female athletes. So female athlete, remember this, all Olympic female athlete. Olympic is going on. So all female athlete, triad is what? They have amenorrhea. Second, their bones are weak, osteoporosis, and third, decreased calorie intake. So these are the three classical things, right? And it can be precipitated by malabsorptive. So even if somebody has a celiac disease, they may precipitate this because already they are not absorbing calories intake, reduced calorie, and top of that they are athlete, right? So these are the things. Stress, high stress and high cortisol, again the second thing. So what is the management is also we need to know, right? So weight gain and decrease training or exercise because they are excessively doing 8 hours 10 hours a day, they are doing exercising, gymming. Second is estrogen replacement therapy, and that is the answer, estrogen replacement therapy. So answer here is a amongst appropriate options. So answer here is estrogen replacement therapy, right? And complication is osteoporosis. We discussed. So 5 of 5 is a good score. Excellent, Dr. Sama, for your diagnosis. But answer is a estrogen replacement therapy. Keep in mind because I created a MCQ regarding the treatment, but they may ask you the diagnosis. So you need to know. So we need to always think of triad. If you get away from your triad, means you are in a danger zone. Don't get away from the triad. Any questions you ask yourself, what is diagnosis, what is investigation, what is treatment? If you cultivate the expertise in this, I can challenge you, you are a master of MCQ, any exam, any exam. So try to do practice from today onwards, those who are not doing. So we need to know diagnosis. So diagnosis is this, right? Hypothalamic uh, amenorrhea, functional hypothalamic, right? Investigation, it's a diagnosis of exclusion. So that is why they had did some investigation, FSH, all normal. And third thing is treatment. So what is the treatment? So treatment is a estrogen replacement therapy. So we discussed three things. Here the same applies: diagnosis, investigation, treatment. Next question: a 29-year-old female who recently immigrated to United States of America presents with extreme vaginal pain. Exams reveal a single, well demarcated necrotic ulcer and inguinal lymphadenopathy. What is the most appropriate treatment? I intentionally designed with the treatment. I'm not putting the diagnosis in this because you need to stretch your brain for the diagnosis, right? So, what is the treatment? And before the treatment, what comes as usual? Diagnosis. Then, until and unless you diagnose, how gonna treat the patient? So, first make a diagnosis. and then make a treatment, and treatment options are this. So select one treatment option. The time starts. Think over it and give the answer. Yes, Dr. Reshma. What do you think? What's the diagnosis, Dr. Reshma? You can unmute your mic. Yes, Dr. Reshma. Any comment from your side? No comment, Dr. Reshma. Dr. Manjit, any comment on this question? Dr. Utpal, Dr. Radhika, Dr. Sabha, Dr. Sherin, Dr. Samia, anyone? Open up your mic and discuss. No one? Why so? Is it so very difficult questions?
Yes.
Yes, Toprak.
Syphilis.
Yes, Dr. Star. You can make your comment.
Is it syphilis, sir?
Sorry, what's the diagnosis?
Syphilis.
Sorry, I'm not getting much your voice, sir. If you can little bit keep your mic closer, I can hear you well.
Syphilis.
I'm diagnosis, Dr. Resma, is a syphilis. Okay. So what point favors syphilis? How did you get to know that okay, this is syphilis, or it could be syphilis, not just confirmatory, but it's a clinical presentation. What do you think that this is a syphilis? And if it is syphilis, then it is a which syphilis? It is a right, means it is a primary syphilis, or it is a secondary syphilis, or it is a tertiary syphilis.
It's a
First of
primary.
all, tell me how did you get to know about syphilis? And if you get to know about the syphilis by satisfying the answer to me, why it is, what it is primary syphilis, secondary, or tertiary? Do you know? Yes or no?
It's primary.
Yes or no? Yes, Dr. Reshma. Yes or no?
Actually, no, it is really syphilis or chancroid.
It's primary.
Sorry, anyone. I mean, three people. It's difficult for me to interact. Yes, Dr. Star. Would you like to tell something? You are trying to tell, but unfortunately, I can hear you well. Yes, Dr. Star.
It's a primary.
Sorry, still I cannot hear. Yes,
Please,
Fatima. Yes,
Can it
Fatima.
be viral infection?
So your diagnosis is viral, not syphilis, right?
No, sir, but I don't know the treatment.
Yeah. So yes, Erin. So what do you think? Why it is a viral?
Sir,
What
this
point favors?
painful necrotic ulcers. Necrotic ulcers usually
So
seen in viral infection.
do you see the extremes vaginal pain in viral? I have not seen so far, honestly speaking.
Sir, we can exclude viral infection as there is no in answer no any viral therapy. All are antibiotic.
Okay, fine. So this is not a viral infection, right? Diagnosis. So what is the diagnosis then? If it is not viral, then what? Somebody is saying syphilis. So what point favors Fatima the syphilis? What point favors Bahar syphilis? Discuss. This is what comes in the exam. We don't need to mug up the answer. You guys are mugging up the answer. You need to do sincere practice from today onward. Believe me.
Sir,
And tell
syphilis
me each
ulcers
and
are
every.
painless and it's painful.
Yeah.
Okay.
It would be the
So,
chancroid, I guess.
so syphilis not there. Why? Because it is extremes of pain is there, right? Extremes of vaginal pain.
Yes.
So syphilis gone, viral is gone. So what else it could be?
It's chancroid.
Chancroid. Excellent. And that is the answer, chancroid. So what point favors the chancroid? Yes, that's correct.
Because it's
Your answer is
painful
it's
and liquid
extreme
vinopathy
painful
is
or a
there.
painful. Okay, so it is a painful. This is most important thing is a painful, which is pain is not there in the syphilis. So remember in your mind, it is a clear cut. If you read the scenario properly and if you have an analytic skill, everything is clear cut in the scenario. But we never bother to read properly. Right? We are hurrying giving the answer. Don't be in hurry in giving the answer. Read. Spend your 95% time in reading the question. Believe me, 90, I can say even 98%. Just sticking the answer, it takes 2 seconds, right? So why you what you are say doing? You are reading, not reading, and you are jumping on the answer. Never ever do this mistake. 98% of the time means if you have 100 second for one MCQ, 98 second you spend on the reading the MCQ and options, 2 second for answer. It is easy. But you are just reading, not reading, and going the answer. So you create each and every MCQ. There is 100% tricks and tips in the MCQs only, but we don't bother to read it. Why it is specifically mentioned extreme vaginal pain? Because to exclude the syphilis, syphilis does not have pain. Is that clear? Yes or no? At least tell me yes or no. Yes or no?
Yes, yes, yes,
Yes,
yes.
sir.
Wonderful. Thanks
Yes.
for
Yes,
your
sir.
energy. Yes, now Fatima, go ahead. So you diagnose what the thing, chancroid. What the treatment you give to the patient for chancroid? You have this
Uh,
patient, this diagnosis, this is confirmed. This is chancroid. So what's the treatment now amongst this A, B, C, D, E? Doxycycline,
azith-
azithro, cipro, penicillin, metro. What you give?
azithromycin,
Yeah,
Sorry,
azithro.
you are asking me or telling me?
I am telling you it. I'm just not sure. I think we'll
Not
give
sure.
azithromycin.
Mhm. So what your heart says in exam, if this comes, what will you take? Azithromycin or doxycycline or penicillin?
I think I will go for azithromycin.
Fair enough. And last questions, you answered excellent two things, right? So this is a chancroid is the diagnosis our triad, right? So the chancroid, this is the diagnosis, investigation, and treatment. So treatment is also clear. It is azithromycin. Now tell me, Dr. Fatima, how you investigate or what is the causative organism for this? This is exam question. What is the
This is
organism?
caused by,
What?
yes, sir.
Yes, yes, tell me.
The organism is Haemophilus ducreyi.
Excellent, excellent. Hemophilus ducreyi. Brilliant lady. Excellent. So this is what the thing is, right? So you need to know in such a way, right? You don't need to mug up your answer, right? So this is a chancroid and it is caused by the Haemophilus ducreyi. The single management single dose of azithromycin or ceftriaxone, that is third generation cephalosporin. There are total 5 generation. If you don't know, go and read it. All 5 generation of
Okay.
cephalosporin. Complication is inguinal abscess because of bulky lymphadenopathy infection may happen, scarring and fibrosis. High yield fat, that is HYF. Chancroid is a rare in United States and start as a papule before progressing to the pustules, means formation of pus. The diagnosis is generally made on clinical ground and difficult to culture this decruvi. What is chancroid? Chancroid is a bacterial infection caused by this Haemophilus decruyi, and chancroid is considered a sexually transmitted disease, right? So this is a STD. And what is the difference between chancroid and syphilis? That is even more important. So I get this slide for you guys just to make it more clarity in your mind, right? So chancroid is a soft chancre and this is hard. What do you mean by soft and hard? Mildly indurated and strong erythema. This is firmly indurated and mild erythema. So erythema is very, very prominent here. Strong erythema, redness. Usually very, very, very painful. Very, very painful. What is very, very painful? Chancroid. Right? Usually painless. Usually painless. In our scenario, extreme vaginal pain, painful. That is again favoring this. Right? And what is the diagnosis? By the direct microscopy, or you can do the gram stain. And here the diagnosis by the direct microscopy or dark field, and here the treatment is azithromycin. or ceftriaxone. This is the answer for chancroid. And your homework is to find out what is the treatment of primary, secondary, and tertiary syphilis. That is your homework. So if you do not know, be more sincere, utilize your Sunday today and try to get the answer. This will come in exam for sure. Next question. Is that clear to anyone? Everyone? Is that clear to everyone? Yes or no?
Yes, sir.
Wonderful. Next questions. 36 years old female G2 P2 at 22 weeks of gestational age with past medical history of prior full term delivery present with incidentally found short cervix on transvaginal ultrasound. What is the most appropriate treatment for short cervix? What's the treatment of short cervix? Is it vaginal progesterone? Is it vaginal estrogen? You wanna give this combined oral contraceptive pills? You do plastic reconstructive surgery of cervix, or no need to do anything? It's fine. Probably this all questions you first time because do lots of hard work in last week and try to prepare these questions to get you the new questions. Yes, post your answer first, then we'll discuss. Yes, anyone. So far, nobody has posted any answer out of 25 doctors in the group. Yes, Sherin, what is the treatment? What do you think? Vaginal progesterone is the treatment? Dr. Sherin, you can unmute and you can discuss.
Sir, vaginal progesterone.
How is gonna help in a short cervix? What exactly vaginal progesterone will do in this patient? How it's gonna helpful to this patient? No? That is what the main thing is.
It will prevent or it will prolong. It will help the patient not go into a sudden dilatation of cervix or a sudden delivery. Progesterone will always try to prolong the pregnancy.
Let's see what other experts are saying, because you are the only one who posted the answer out of 25 doctors to whom I discuss. I don't know. Yes, Yogapriya, what do you think? What's the answer? Dr. Zainab Ali Hassan, what do you think? What's the answer? Reshma.
Sir, answer could be vaginal progesterone or mostly I'm confused with A or also there is also cervical stitch or cerclage we can do. That is for
So,
cervical incompetence, but here could be vaginal progesterone.
vaginal, how it's gonna help this patient?
It will uh, prevent contraction, and it will prolong pregnancy till full term.
Okay, fair enough. So, yeah, so this is short cervix. Answer is vaginal progesterone. The complication of short cervix is a preterm delivery. Cervix is short, obviously. So this is an incidental found. High yield fact is an incidental found or findings. Short cervix on routine transvaginal and increase the risk of preterm delivery. So vaginal progesterone can help this patient. So that's the answer. Last couple of questions for today. Question 8. 5 years old female with history of multiple fracture presents with growth of pubic and axillary hair. There is a special gift from my side for making a diagnosis of this patient. Special gift. A 5 year old female with a history of multiple fracture present with a growth of pubic and axillary hair as well as breast development. On examination, she has a coarse dark hair across the pubis and under her axilla, as well as breast buds and multiple large macules on her right torso. Labs or investigation shows advanced bone age, low serum TH, ovarian cyst on the ultrasound. what is the most appropriate treatment of this patient? So before jumping to the treatment of the patient, I think we should know the diagnosis of the patient. So again, our triad comes here in the picture. So first we need to know what is the diagnosis. So anybody is giving me the answer A, B, C, D, E, tell me the diagnosis as well, or likely point favoring diagnosis. So far, no answer.
Sir, PCOD, it is a case of PCOD, sir.
PCOD. So now,
PCOD.
fine. We'll discuss. I'm not in hurry. So who has told the PCOD?
Yes, sir, myself, Dr. Monica, sir.
Yes, Dr. Monica. So what point favor this PCOD? Now you tell me. One,
Sir,
two, three. That okay, these are the point. Yes.
it is growth of pubic and axillary hair, early premature, and
Pre-match.
low serum LH, ovarian cyst on the ultrasound,
Okay.
ovarian
Okay.
cyst on the ultrasound, and low serum LH.
Okay. So do you think it happens at the age of 5 years, PCOD?
So it is it's pointing toward precocious puberty.
Okay, so now little change the gear is a precocious puberty. Precocious puberty. So what do you understand by precocious puberty?
Before age, before age, it is attained.
Before age means what age? I can take it cutoff line of any girls or female comes to me. So what is any age
Five,
cutoff line? 8 years,
5,
9 years, 10 years?
5,
Before 8 years. Before 8 years.
Before 8 years. So if before 8 years, what happens? Then you can say, oh, this is precocious puberty. What happens before 8 years of age in female? What which you cannot, which is not present, but now having with this before 8 years of age, you say, oh, this is precocious puberty. What is that?
Sir, breast development is not there at the age of 8.
Okay, so this is breast bud is here, right? They mention here the breast buds, right? Okay, fine.
Yes.
What else? Only breast before 8 years of age? Because what in examination? See, coarse dark hair,
any of that, sir.
dark hair across the
Puberty,
pubis. So dark hair across the pubis.
menarche,
Then under the axilla also there is hard.
telarche, pubarche, and menarche, sir. Any of these.
Sorry.
Telarche, pubarche, or menarche. Any breast buds or pubic hair or menstruation. Any of
Okay,
these.
fine. So what could be again the same question comes? What could be the diagnosis or what could be the differential diagnosis? They have multiple fractures as well. History of multiple fracture. Female with a history of multiple fracture present with. So she also have a history of multiple fractures as well. So do you think, Dr. Monica, there is a multiple fracture in 5 years of age with polycystic ovarian disease?
Multiple fracture pointing toward multiple fractures. No, sir. PCOD not there.
Less likely. I mean, not there is. So then what it could be there then? That is, I did not announce the in a lollipop question they give. Anyone? Anyone and have any clue, especially the gynec expert or gynec department people are working, right? Any idea, any clue? Just for discussion. So somebody told PCOD. Okay, fine. Another is precocious puberty. Anything third thoughts comes in the picture or mind? So this is a McCune-Albright syndrome. Very difficult name to pronounce as well. McCune-Albright syndrome, activating mutation of the GNAS gene. What is the clinical triad? Polyostotic fibrous dysplasia, right? Fibrous tissue grows multiple bones and predisposed to the fracture, deformities, and limping, right? So, if you have any out of this triad, if you have two things, it is a McCune-Albright syndrome. Second is autosomal endocrine hyperfunctions. The most common form is a precocious puberty because of autonomous endocrine hyperfunction, not hyperfunction. So puberty is very early. So most common form is a precocious puberty, which is typically gonadotropin independent. And third is cephaloid spot, or there is a appearance of cost of man appearance things. And how you manage this patient, right? So you need to control the hormones under or estrogen under control, and anti-estrogen drug called as a tamoxifen citrate or letrozole is a drug. These are the selective estrogen receptor modulator drug. And here the answer is the letrozole. It is anti-estrogen, anti-ER or androgen this drug, right? So letrozole is the drug of choice here. So what is that? This is McCune-Albright syndrome's complication is recurrent fracture, which is there in our scenario. Recurrent ovarian cyst, it is there in our scenario. Acromegaly, Cushing syndrome could be present, right? And high yield facts for this is that McCune-Albright is a triad of irregular cephaloid spot or macules, uh, this fibrous dysplasia, polycystic fibrous dysplasia, and peripheral precocious puberty. It occurs much more often in girls than in boys due to mutation and genes, which encodes a subunit of GS. We don't need to remember this, just for your knowledge. I reviewed this syndrome because I have not seen such patient in my practice. So I just reviewed and I got this as a pilot study from 2007 found that the letrozole, that is the anti-estrogen drug, a third generation aromatase inhibitor, may be effective in treating the precocious puberty in girls with McCune-Albright syndrome. And this mass is a rare disorder that can cause precocious puberty due to ovarian cyst that secrete the estrogen. In the study, letrozole was found to decrease the growth and bone maturation and slow or stop the menses, and significantly decreases the ovarian volume, improves the growth velocity, and increase the predicted adult height. So overall, this letrozole, third generation aromatase inhibitor, will help in this patient. So this is a little complex triad, right? And now once you read, everything is matching in this scenario. So just keep in mind, sometimes they ask you tricky questions. McCune-Albright syndrome, right? Treatment is a letrozole. That's it. Last couple of questions. A 3-year-old previously healthy male presents with soft continuous murmur based heard right under the clavicle. The murmur disappears when the lies down or extend his neck and turn his head to the right. What is the treatment? So here there is no diagnosis. First you make a diagnosis and then treatment. So options are, you just reassure this patient, you give indomethacin, you do valvular surgery because of murmur or some valvular problems, or you start the prophylactic antibiotic for this patient, or all of the above you can use for this patient. Yes, now tell me. Yes, Fatima, why it is a indomethacin? What is the diagnosis here?
Sir, it's PDA.
Sorry?
PDA, patent ductus arteriosus.
So this is, you think this is a PDA. So what is PDA? What happens in PDA? Tell me two couple of words about PDA. Patent ductus arteriosus. So what happens in patent ductus arteriosus?
Sir, ductus arteriosus is supposed to close after birth, but it stays open.
Okay.
And there is a continuous machinery murmur we hear in PDA.
So continuous machinery murmur. But here they mention only continuous murmur, not machinery
Continuous
murmur.
murmur was right to the clavicle.
Okay.
When he lies down.
And do you think this PDA murmur will disappear when somebody lies down or extend his neck or arm? Do you think so? So by
No,
turning your head on the right, you think that per PDA will close and there is a no murmur, because they mention the murmur disappear when he lies down. When he lies down, murmur disappears.
against a fine position. Okay.
So this is positional murmur, right? In other sense, right? Because if you lies down, it goes, extend his neck or turn his head on the right, it goes away, murmur. So what is the condition in which you can see such things? So that is a diagnosis. And
It's an
once you get,
innocent murmur.
it is an innocent murmur. What is innocent murmur now then?
Innocent murmur is uh, temporary present होता है और ये supine position पे disappear हो जाता है and we can, it's not a worrisome situation. It's just a physiological functional murmur.
Okay, and it is based heard on the this clavicle. Innocent murmur based heard on the clavicle, right? Under the clavicle, clavicle is way high up, right? Clavicle is almost in the neck. So do you think this innocent murmur will heard on the neck? So your homework is to read one, what is innocent murmur, right? What is patent ductus arteriosus? These both are not the answer. Still, anybody wants to try for the answer, first get me the diagnosis. Now, every time you get such a little tricky MCQs only, not just lollipop one. Anyone? Dr. Bahar Toprak, Dr. Hina, Dr. Yogpriya.
Is patient cyanotic or acyanotic, sir?
It is
Maybe
not
the
mentioned. So what do you think that it is cyanotic or acyanotic? They have not mentioned anything in scenario. So what do you think? It is cyanotic or acyanotic? When it is not mentioned, it means there is no cyanosis. If it is there, then they will mention in the scenario. You understand?
I
Yes,
think
doctor.
it's
Yes.
aortic stenosis.
Aortic stenosis. Very interesting. Third questions. Third differential. So now tell me
The
what point
venous
favori
hum.
aortic
Murmur
aortic.
is under the clavicle, so that's why I'm thinking. So,
No. I'm extremely happy you are interacting and trying to make some thought process in your mind. This is how we have to learn. So now tell me in aortic stenosis, what happens? What age happens? What kind of murmur say? And where is the best murmur you can listen in aortic stenosis? Tell me few questions. What kind of murmur you can see? First of all, tell me systolic murmur or diastolic murmur. Then second question, mid systolic, mid diastolic. That is second
mid
question.
systolic murmur.
Mid systolic murmur, mid
Yeah.
systolic murmur. Okay. So at least systolic murmur and mid systolic murmur. But it is not a continuous murmur, na?
Yeah.
Systolic means what? When there is a systole, ventricular contracts, heart will, I mean, aortic valve open, you get some systole, right? So systolic murmur. So murmur at the time of systole, you get it, right? But they are saying here continuous murmur, doctor. And what I understood by my basic cardio knowledge, murmur is systolic and diastolic. So between systolic and diastolic, if murmur is heard, it is called continuous murmur, isn't it? Yes or no?
Okay. Yes.
So do you think it is aortic stenosis? This is one question. Second question, what is the commonest age of aortic stenosis? That is the second question.
Yeah. It's,
Yes, tell me. I mean, whatever ideas or concept you have in mind where you treated patients, or probably you must be working in some clinic, right? So how they present? What is the age? At what age usually you see the aortic stenosis patient treated or heard, or if you have sometime ICU visit, you see na, what kind of patients are there?
yeah. It's not AS. I think AS is very common after the age of 50, 55, or 60.
There they are mentioning doctor 3 years of age,
Yeah.
because that is the art of learning. You need to see age, you need to say sex, you need to say presentation, you need to say what type of finding, aggravating relieving factor. Everything is important in every MCQ. Where it is heard in clavicle, right? So what are the murmur which can be heard in clavicle? That is the clue.
The
Sharing any idea, Dr. Sharing?
venous hum sort of.
Venous hump. So what is venous hump?
It is
That is the answer.
in
Venous hump is the answer.
children.
Diagnosis is venous hump. Excellent. But what is a venous hump?
In children,
Venous hump.
sir, we might be able to hear that velocity of movement of blood even when it is normal.
Fine. So venous hump is the answer, right? So now go and read the venous hump. It is a simple, right? But we never thought of this. Fatima, go and read it. Bahar, Toprak, read it. Right? Read the venous hump today. Read the venous hump. Reassurance is the patient, complication is none,
Yes,
it is a
sir.
benign condition, right? So venous hump is a continuous murmur. Venous hump is a continuous murmur that results from the normal venous flow through the jugular vein. Vein, venous means vein, arterious means artery. So venous means something vein. Which vein? So jugular vein, GV, jugular vein. By extending the turning, because jugular is in the neck. So if you just rotate the neck on the right side or manipulate the things, murmur will go, right? So by extending or turning the neck, the jugular vein can be occluded, and when they occluded, disappearance of the murmur. So this is called as a venous hump. So venous hump is the classical. This is a classical presentation of the venous hump, and I got one more slide to read for you. Blowing and continuous extracardiac murmur that is loudest during diastole, whining, roaring, and wheezing. Intensity varies from faint to grade 5, louder under the inner edge of the right clavicle, but extends from the supraclavicular areas over the right internal jugular vein to the base of the heart, right? And causes results from the turbulent flow caused by the two streams of blood entering into the superior vena cava, right? And listening with the bell of the stethoscope in the right supraclavicular space. This is a classical venous hump. So don't miss out the venous hump in your exam. And last questions for today. Uh, Child with the lesion on the face, honey crusted lesion, right? So you can see this picture. I brought the picture for you as well, not just the description. So if you, even
Okay.
if you don't see the options, you can answer it. First, again, diagnosis and then treatment. Diagnosis and treatment. So they ask the diagnosis. So see the picture, child with the lesion on the face, which is honey crusted lesion. What is the diagnosis? Impetigo, scarlet fever, hand foot, mouth syndrome, parvovirus B19, or roseola. Let the other guys to put the answers as well, and then we'll hold it here.
Impact.
Yes, Dr. Hina, any comment?
Sir, impetigo is a yellow crystal lesion on the face.
Okay, impetigo.
And
So what point favors impetigo, or what is impetigo? What causative
crystal
organism of
lesions,
impetigo?
crystal lesions,
So this is the
superficial
impetigo.
crystal.
Yeah, so this is the answer. Impetigo is a correct answer. So this is a classical. Don't just print this picture in your brain. This is impetigo. Classical, same picture will come in exam, not different. Same picture will come in exam. So impetigo. Now this is the diagnosis. How you investigate or how you confirm the diagnosis? By which investigation you confirm, doctor Hina, that okay, this is impetigo, and what could be the treatment of this?
Sir, if it is primary infection, then we will let it go. We will do not give treatment. If it is secondary, like infections occur, then it mostly probably Staphylococcus aureus. Then we will give antibiotics.
Okay, so which antibiotic you will give, doctor, to this patient?
Azithro.
Azithromycin. So azithromycin you want to give to this patient? Azithromycin cover which organism?
Staphylococcus.
Staphylococcus. What else? Fine. So you had given quite good answer. So not a problem. So this is impetigo. The clue is a honey crusted lesion. Remember honey crusted lesion. Honey crusted lesion. So this is called honey crusted lesion.
Yellowish in color, I think.
Yes, sir.
Yes. So impetigo is a honey crusted lesion on the face. Management is keep skin clean with the soap and water, topical antibiotic ointment covering skin flora, including staph and staphylococcus. Doctor, remember this antibiotic very well that is called as a mupirocin. Mupirocin. This is a treatment of choice. Mupirocin. This is the answer in the exam. Here I ask the diagnosis, but they may ask you the treatment. So mupirocin is a number one treatment, and that is topical ointment, topical local application. And what are the
Sir,
complication of
what
this?
about fusidic acid, sir? If
Sorry?
there is fusidic acid, sir, what about fusidic acid? If it is there in the
Fusidic is also used. Yeah, fusidic is also used. I used in few patients, but for the exam point of view, first choice is a mupirocin, right? That is also
okay, sir.
effective.
Okay,
If
okay, sir.
GAS or gram A streptococci, what are the complications? If GAS or gram positive, group A streptococci, scarlet fever, post streptococcal glomerulonephritis, but not acute rheumatic fever of impetigo, right? Complication. And if the Staphylococcus aureus, staphylococcal scale skin syndrome, and high yield point, most skin and soft tissue infections are either due to group A or group A strep or Staphylococcus aureus. That's all. I have few questions, but I will stop it here and keep it to the next sessions of ours. I need one favor of having couple of feedback of today's class. How's the quality? How's the learning? And what makes you little more confident today in the lecture? Couple of feedback. Fatima, any feedback?
Yes, sir. The class was very good and it was quite conceptual, and I got to know about certain new things like McCune-Bright syndrome. What I had no idea about it, so it was good one.
Okay, great. Thank you very much for your kind feedback. Anyone? Anyone?
Sir, thank you for the class today, sir. Actually, it was if we had done some of these questions alone, we would have skipped the diagnosis part and would have made a answer out of excluding the other answers. I have done it even now, but I would not have thought. I would not have spent the time to think about the diagnosis and think about the surrounding things if it was not for your class, sir.
Excellent. Thank you very much. Anyone else? Anyone? Dr. Zainab? Any feedback? Dr. Reshma, Dr. Monica, any comment?
Yes, sir. Your class was very interesting and informative, sir. Really, thank you, sir. Thank you so much,
So
sir.
what's the learning today to you? That is most important. What is a new learning for you?
Sir, all this McCune-Albright syndrome question,
Okay,
I learned in
great.
this.
Wonderful.
Okay.
Wonderful.
Thank you so much, sir. Thank you, sir.
No problem. You are welcome, doctor. Dr. Reshma, any last comment?
Yes,
Yes.
I should
What's
say
your what's
yeah. First of
yeah,
all,
go
thank you
ahead.
very much for the class, and I'm very appreciated by the triad you showed.
Wonderful.
Not only in this class, the last class I attended one class, but for this class I could notice this triad mainly. We generally don't concentrate on that, so
So
which
now
makes it
onwards you
easy to
concentrate on that,
sure.
right? So that probably improves your things. So fine, fair enough. I think if anyone wants to have last feedback, I would be happy. Otherwise, we'll end up here. Anyone last? Any volunteer? Fine, fair enough. So we'll end up here. Thank you very much, everyone, for joining the class. I will post this video on our group as well. So those who missed out. And one more request, we have lots of such mock test of mine on our YouTube channel, Medical MCQ for all. So look into it, subscribe it so you get all the update. Even if you miss probably next Sunday, you can see it online. right? So you cannot miss anything. So thank you very much once again, and listening me fully calmly, and enjoy your Sunday, and thank you very much. See you soon. Good day.
Thank you, sir.
Okay, thank you, sir.
Bye bye.
Thank you, sir.
Thank you so much.
Thank you very much. Thank you. Take care. Bye bye.